So the title of this unit properly is Public Health Approaches to Oral Health. So what we're going to do is just to revisit a little bit, very briefly, some of the definitions of dental public health, and then think about how we define a public health problem. Then we're going to apply that to dental diseases and think about, quite critically now, which of our dental diseases are actually public health problems, by which we mean not just the ones that are of interest to dentists, but the ones that have more wider significance in terms of public health more generally. Okay? So we are going to think about what makes a public health problem, then think about, based on that, how we're going to tackle the problem, and then we're going to use periodontal disease as a case study to think about whether periodontal disease is a public health problem. And those of you that have sneakily read ahead in your handbook will see that we have exam-style questions like we did for the first module, and we're going to, at the end of this session, do a bit of a brainstorm of an exam-style question on this topic. So, dental public health problem, a definition, or dental public health, a definition. And I'm just putting it up now, just to remind you that it's about prevention, it's about promotion, so preventing oral disease, promotion of oral health, and when we think about oral health, thinking about that in its widest sense, so not just absence of disease, but the eating, speaking, socialising, that general, very broad view of oral health. We're thinking about how it can contribute to a person's general quality of life through the organised efforts of society. So we know that if we're going to try and implement dental public health or try and improve oral health, we have to be organised, and we have to do it in an evidence-based way, and we have to involve skills of advocating with politicians, with health services, that type of thing. So that's the definition. We like to start with a definition. And again, just to remind you that dental public health is about the community rather than the individual. We're not necessarily, we're not always concerned with what benefits the individual. We're thinking about what benefits the community. We will be doing quite a lot of this in the module, applying research findings to community. We're not necessarily interested in people's strep mutans counts or how much porphyromonas gingivalis they've got floating around in their pockets. When we say causes of disease, we're thinking about more like determinants. Okay, so just some of the key principles of dental public health, and we are also thinking about, when we talk about dental services, we don't necessarily mean that individual patient-dentist interaction. We're thinking about the organisation of dental services. So the stuff that we had in the first module about what's quality, about how the way that you pay dentists and dental care professionals affects their activity. So that's the sort of thing we talk about in dental public health when we mean dental services, as opposed to that one-to-one kind of clinical interaction. So what is a public health problem? We use these criteria to think about and sort of evaluate whether a problem has got public health significance. So there's 4 criteria. The first one is that the condition, so to have a public health significance, the condition needs to be either very common, so prevalent in the population, or serious. So it needs to be prevalent. If it isn't common, then it needs to have quite serious implications. So serious, we mean like mortality. Oral cancer, I suppose it's common in some countries. It's not that common in other countries, but if you get it, it's very serious consequences. So that's the first criteria. The second criteria about what impact it has on the daily lives of those that have it and the population that have it. So what are their consequences for their daily lives? Is it something that bothers them from day to day? Is it something that they even know they have? So it's what are the consequences, the impact, what impact does it have on the quality of life, the day-to-day life of those that have it, and as a community as a whole. The third one is about the cost to the community and the individual. So usually this is in terms of financial costs. So the cost to the community might be how much does it cost to treat the disease. So this varies between countries, but in some countries, particularly here in the UK, we spend millions, if not billions, treating dental diseases. Some diseases cost more than others. And again, to the individual, what are the costs of having that in terms of maybe the cost of paying for treatment, but also time off school, time off work, sleepless nights, all those kinds of things that health economists put costs on. Okay? And then the fourth criteria is whether there are methods available to prevent the disease, sort of alleviate the symptoms or cure it. So if a problem is very serious, it's very serious consequences, it has high costs, but we can't do anything about it, then it doesn't necessarily have public health significance. We need to be able to justify whether a condition is of public health significance by thinking about all four of those criteria. Okay, so we're going to come back to that, but just planting that in your mind, because when you think about whether something is a public health problem, the next step from that is how we're going to tackle it. So if we identify something as a public health problem, it's meeting those criteria, and we know then that we should be able to prevent it or treat it or cure it, then once we've identified it's a public health problem, we need to think about how we're going to tackle it. And to do that, we need to have strong evidence to say, yes, it's something that's worth tackling, strong evidence of what's going to work to tackle it, and as well as that sort of evidence base that we get from research, we also need to have support from the public and acceptability, and you'll hear a bit more about this with respect to water fluoridation as we go along. It needs to have good professional support, so from dental colleagues and other healthcare professionals ideally, and it needs to have economic benefits, because in any healthcare system throughout the world, one of the key aspects is the economic elements of it, because we never have an unending supply of money. Usually it comes down to, or it could be resources in terms of time, but usually that's money. So we have going to talk about in this session particularly about public health problems. What is a public health problem? And then thinking about ways to tackle it based on that problem. But then if we go back to the definition of dental public health and the idea of the principles of dental public health, we know that to really tackle most of our dental public health problems, we need to consider that the causes are very, very complicated. So it's not just as easy as thinking, right, kill the strep mutans, get rid of caries. All those things, diet, oral hygiene, trauma, optimising exposure to fluoride, tobacco, they apply to some extent to all the conditions. So we have a public health problem, we're thinking about ways of tackling it, but we know that to tackle it properly, we have to think back to the determinants. Okay? Is everybody with me so far? And we know that those determinants and those relationships between them are very complicated and actually really, really difficult to address. Now, in the past, we've often addressed them by thinking about prevention, which is a kind of, usually a sort of clinical prevention or a sort of health education sort of style. And over the last 30 or 40 years, particularly in the UK, that the emphasis has been on education. If you give somebody knowledge, then it will change their behaviour, they can change their lifestyle, and the diseases will suddenly reduce or they'll suddenly go away. And I'm sure that Tom and Peter have covered this a lot with you about the fact that those lifestyle approaches to prevention don't work very well. We can all think of examples in our own lives where we know something is bad for us, but we still do it. I can think of quite a few examples. So, if we think that just by giving everybody knowledge they will change their behaviour, we will be very disappointed. And you can see this clinically when you treat patients. You think, I've talked to this person, I've spent 20 minutes with them talking about brushing and diet, I've tried to stop them eating sweets, I've tried to stop them having sugar in the cups of tea, but they're still coming back with more caries. Or I've got this family and I've talked to them about their older children, and look, the younger children are all coming in, they've all got caries coming out their ears. You want to beat your head against the wall because you just can't stop it. And that's because if you think you can change somebody's lifestyle by just having a chat with them, you can't. But kind of almost a little bit worse than that is that it can and does, there's lots of examples of it actually increasing inequalities, because for everybody you talk to, this lifestyle approach, this prevention education approach, for the majority of the population it doesn't work. But for a small percentage of the population who are usually relatively less deprived, so they're usually more affluent and have availability of more resources, money and time, whatever to them, those are the people, if anybody's going to take up the advice, those are the ones that do it. So what you end up then getting is that the people who really need to benefit from it don't change their lifestyles. The people that actually have already got probably pretty good lifestyles, they do change a bit more, so the gap between the unhealthy ones and the healthy one just grows, which is good for the healthy ones, but as a population that kind of isn't great. It makes it look almost, the contrast is more stark. And the other problem, and you will remember hearing about this in the first module, is that it's very much about victim blaming, about saying, it ends up with saying, well, you don't brush your teeth, you don't you smoke, you do this, in a very accusative way, without recognising that the reason that people do things, the reason that we do things that are bad for us, are for many, many different things, because they make us feel better, because we feel a bit fed up, we're a bit tired, we want a bit of chocolate, we can't stop ourselves. It's not, we shouldn't victimise people who have quite difficult lives and are just doing something that's a bit unhealthy just to give themselves a bit of a boost, because that's just a kind of human nature. So when we're tackling a public health problem, if we take this lifestyle approach, then we could increase inequalities, we could make people feel like victims, which makes them even less likely to want to change, and they don't work.